So I've been asked to give the title of his talk. But the nice thing is I've taken the opportunity here to show all of you, and this is actually the world debut for a novel Tavor platform. So this is the first time it's ever been shown publicly, and so I have the distinct pleasure of showing you this here at this conference. So when you look at current Tavor challenges, and many of you have already heard about this, and Alan touched upon this as well, is that there are challenges with regards to hemodynamic performance as well as a patient prosthesis mismatch. These valves are expensive because they're very costly to manufacture. And as you've also heard, there are also some issues in terms of long-term management, whether it's a need for valve in the future, coronary access, or other issues. And then there are also these still lingering questions about prosthesis durability, especially as we start to migrate into younger populations in whom Tavor is often being considered. So if you look at what's out there, there are many different technologies that are being pursued for novel tissue processing to do transcatheter valves. And this is just a slide of just three. And if you were here last year, you heard Mike Mack talking about Zeltas, which is this bioresorbable frame that you implant and it gets serialized and then dissolves in the human. There's a technology called Straight Technologies, which is one of a number of polymer-based valve technologies that are being developed. It's very exciting because, as you might guess, polymers are much cheaper than pericardium. And one that's already in practice already is the Inspiris valve, and Alan touched upon this. This is made using the Resilia technology for processing to address free glutaraldehyde treatment. So the technology I'm going to describe to you today is called ADAPT. This is a technology, and Alan actually showed you the same slide earlier. This is a glutaraldehyde-free way of processing these tissue leaflets. So on the left-hand side, you can see a traditional prosthesis processed with glutaraldehyde. And you can see there's inflammation from the fluorescent staining, which you can see, as well as inflammation and lymphocytic infiltration. But if you look on the right-hand side, this is a pericardium that's been treated with ADAPT. And this allows the tissue to get to the most pure collagen scaffold with no inflammation. You can see that there's a non-reactive fluorescent stain and no inflammation in the tissue. And with that, because it decellularizes and removes all that DNA and cellular elements, it reduces the number of calcium binding sites, because when you have residual DNA, residual cell elements, those are the calcium binding sites that inflammation tacks onto and leads to problems with durability. And so here's some examples. So if you look, these are various tissue processing techniques in companies, and probably Core Matrix is the one that's most commonly known, and Photofix is on there too. But CardioCell here, there's no residual DNA and no calcium binding sites. It's actually zero, believe it or not. There's also this way in which you can take the tissue and use a technique called Samurai. And what Samurai does is it takes the tissue and makes it uniform in thickness. Because if you know anything about how these pericardial valves are done, you have a technician that overlays a sheet of pericardium and finds the areas that are appropriately thick and then cuts out the parts to make the leaflets and sews it all together in a prosthetic valve. But what this Samurai technique does is it can take an entire sheet and make it whatever thickness you want, 20 to 40 microns, and also make the surface very smooth. And the nice thing about that is that when you can make the pericardium very thin, it allows you to pack it into small spaces, so smaller delivery catheters. It also increases your pericardial yield. You don't have to buy as much pericardium if you can change it. And then the nice thing about this Samurai technique is it maintains mechanical properties and enables 3D molding. So you can do something like this. So this is the first public display of this technology, and you can see here on the left-hand side, this is the pericardium, which has been samurai'd, processed, and then molded. And you can see here with that mold, you can create what is now known as a single-piece Tavor valve. And so in the middle, it's a valve, it's a sheet of pericardium which has been put together with just 15 stitches that can be used to sew it onto the frame. As many of you are aware, many of these Tavor prostheses actually take over 150 stitches to sew, and you may have heard the other day, 24 hours to actually make by a single person. And here, this is the concept. It's a supravalvular hemodynamics, and this is the cycle tester. We're now past 400 million cycles, so very excited to see this come. And Alan and Gaurav have been involved in this as well, and this is the Admetus Tavor platform. And you can see this is the way it's done, is that the tissue, because it's so controllable in terms of the thickness and its malleability, it can actually be implanted in an inverted position. So the single-piece valve is put in inverted on the frame, and then it's actually inverted as it's inserted into the patient. And what that does, it allows Tavor with a 14 French OD. So remember, that's OD. So if we're talking ID, that's as low as 10 or 11 French, or maybe even single digits. And so it's a very exciting platform that we're going to be seeing going into humans in the next year or so. And this is a video of how it's done. And hopefully at this conference next year, we'll be able to describe this technology for you in humans. So thank you very much.